Hi everyone, my name is Dr. Janmohamed, and I'm the medical director of the Mechanical Circulatory Support and Heart Failure Program at Mercy General Hospital. Heart failure is basically a condition where you have a disorder of the heart muscle itself. Your heart's a muscle and its job is to pump blood to the rest of the body. So there are different types of heart failure. There's heart failure affecting the right side of the heart or the left side of the heart. And the symptoms could manifest with problems breathing when you walk. It could be swelling of your abdomen or your legs. People that are at risk for heart failure include patients who have certain conditions such as high blood pressure, high cholesterol, diabetes, people who have sleep apnea. These are all risk factors for development of heart failure. Signs of heart failure include trouble breathing when you walk. It could be trouble sleeping at night where you have to use extra pillows so you don't get short of breath. It could be swelling of the legs or the abdomen. There are some factors that you can modify to prevent the development of heart failure. A very common cause of heart failure is heart disease, which means blockages of the heart. And we know there are certain risk factors for blockage of the heart. These will include diabetes, high blood pressure, and high cholesterol, smoking as well too. Other risk factors such as genetics, we can't modify that. But for the others, we can, when we see our physicians, we can ask, what is my blood pressure? Is it at goal? How are my sugars doing? How is my cholesterol? So these are things you could actively work on. And hopefully if you actively work on this will prevent the development of heart failure. Okay, once you're developed with heart failure, it's first important to figure out what type of heart failure do you have. Is it on the right side of the heart? Is it on the left side of the heart? Is it a problem with the relaxation of the heart? Is it a problem with the squeezing of the heart? Because each type of heart failure has a different treatment. So once you're able to identify what type of heart failure you have, then you can prescribe certain medications that hopefully will make the heart improve and clinically you feel better. As we mentioned before, there's different types of heart failure, but one I see very often is heart failure where the heart is not working very well. And we have a lot of great therapies for these patients. It starts with medications, it starts with adjustments of their diet, and sometimes these patients may need devices to help their heart work better. If you have any of the symptoms we just described, it's imperative that you make an appointment with either your primary care physician or your cardiologist. You can go to the office or you can do a virtual visit to talk about the symptoms that you're having to see if you have heart failure. And if you have heart failure, place on therapies earlier on so hopefully this can improve your symptoms.